You reach climax. You feel everything, but nothing comes out. That moment can shake you. You start asking yourself, what is going on with my body? Let me tell you this right now. You are not the only one dealing with this. Hi, I'm Dr. Ross. In today's video, we are going to talk about why you can feel orgasm but see no fluid. By the end of this video, you will understand what is happening inside your body, what it means for your health, and what steps you need to take. In my clinic, I see many patients with this problem. Some come in worried, some come in scared. Most of them think something is broken. But here's the truth. In many cases, this has a clear cause and a clear solution. Stay with me. Later in this video, I will show you one simple sign in your urine that gives you a big clue. I will also explain a common medication that silently causes this problem. And there is one mistake many men make that makes things worse without knowing. Let's talk clearly. What you are experiencing is called dry ejaculation. This means you reach orgasm, you feel the pleasure, but little or no semen comes out. Now here is something many men do not know. Orgasm and ejaculation are not the same thing. They usually happen together, but they are controlled by different systems in your body. Orgasm comes from your brain and nerves. Ejaculation depends on muscles, glands, and pathways. So you can feel pleasure, but the fluid part fails. That is why this situation feels confusing. Does this mean you are no longer a man? No, it does not. This is a body function issue, not a loss of masculinity. Some men still have normal erections and strong desire, even with dry ejaculation. That tells you the system is partly working. This is more common as you get older. This is common in men over 40, even more common after 50 and 60. But younger men are not completely safe. In my clinic, I also see men in their 30s with this issue. You are at higher risk if you have diabetes, if you have high blood pressure, if you've had prostate or bladder surgery, if you take certain medications, if you have long-term nerve problems. Ask yourself this. Have you had surgery around your prostate? Do you take medication for blood pressure or prostate? Do you have diabetes? If yes, your risk is higher. Now let's break down the main causes in a simple way. The first cause is backward flow. This is called retrograde ejaculation. In simple terms, the fluid goes the wrong way. Instead of coming out, it goes back into your bladder. Think of it like a door that should close, but stays open. During orgasm, your body should close the bladder opening. This forces semen to move forward, but if that door stays open, the semen goes backward. You still feel the orgasm, but nothing comes out. In my clinic, this is the most common cause I see. Here is a simple clue. Your urine may look cloudy after sex. That is the semen mixing with urine. This often happens after prostate or bladder surgery. It can also happen because of certain medications, especially drugs used for prostate enlargement or high blood pressure. These medicines relax muscles, but they can also affect that important valve. Do not stop your medication on your own. Always speak with your doctor first. The second cause is a blocked pathway. Your body produces fluid, but it cannot come out. The pipes are blocked. This can happen after infections. For example, untreated prostate infection. Scar tissue forms. That scar blocks the flow. Some men develop tiny stones that block the ducts. This does not happen suddenly. It builds slowly over time. You may notice less fluid over time. You may notice thicker fluid. You may feel mild discomfort in your lower abdomen or pelvic area during orgasm. Many men ignore this small discomfort for years, not knowing it is connected to this issue. The third cause is low testosterone. This is your main male hormone. It supports sperm production. It supports fluid production. It supports your desire and energy. When levels drop, everything slows down. You may first notice less semen, then lower desire, then weaker erections, then low energy. In my clinic, I see many men who think this is just aging, but often it is a treatable hormone problem. Let's talk about what you may notice. You feel orgasm, but no fluid comes out, or very little comes out. You may notice changes in your urine after. You may feel less intense pleasure. Your sex drive may reduce. You may feel tired more often. Ask yourself again, do you climax but see no semen? Has your semen reduced over time? Do you feel tired often? Has your desire reduced? Do you feel any discomfort in your pelvic area? Do you take long-term medication? If you answered yes to more than one, do not ignore this. Sometimes this condition is harmless, but sometimes it is a warning sign. It may point to nerve damage. It may point to uncontrolled diabetes. It may point to hormone imbalance. In rare cases, it may point to serious problems affecting the prostate or nerves. Ignoring it is a mistake. Long-term uncontrolled diabetes can damage the nerves that control ejaculation. And once nerve damage becomes severe, recovery becomes harder. So early action matters. Here is something that may surprise you. Dry ejaculation does not always reduce pleasure. Many men still feel normal orgasm, so they ignore the problem. But inside, something is changing. Do not judge your health only by how you feel. Pay attention to the signs your body gives you. Some people believe no semen means you are infertile forever. That is not always true. In some cases, sperm is still produced. It just does not come out in the usual way. Some people think this means your sex life is over. Most men continue to have a normal sex life with proper treatment. Some think it only happens because of age. That is also not correct. Age plays a role, but surgery, medication, and health conditions are major causes. So how do we confirm the cause? We start with your history, your medications, your past surgeries. Then we do simple tests. A urine test after orgasm. This checks if semen is going backward. A blood test. This checks your hormone levels. Sometimes imaging tests if we suspect a blockage. In most cases, the diagnosis is simple. A simple urine test done right after orgasm can give a clear answer. Now you understand what is happening. You understand the causes. But the big question is this: what can you do about it? Can it be treated? Can it improve? Can it be treated? Yes. In many cases, it can be improved. And in some cases, it can return close to normal. But the key is this: you must first identify the cause. And guessing delays results. In my clinic, once we find the cause, treatment becomes clear and focused. Let's go step by step. If the issue is backward flow, what we call retrograde ejaculation, treatment depends on what caused it. If it is due to medication, doctors usually review your drugs. Sometimes we adjust the dose. Sometimes we switch to another option. Never stop your medication on your own. I repeat this again. Never stop your medication without medical advice. If the cause is related to nerve control, certain medications can help tighten that bladder valve. These drugs help direct the flow forward again. Results vary, but many men see improvement within a few weeks. Now, if the issue is a blockage, treatment focuses on clearing the pathway. If it is inflammation, doctors usually recommend medication to reduce swelling. If there is infection, antibiotics are used. If there is a structural blockage, a minor procedure may be needed. These procedures are often simple and targeted. Recovery is usually fast. In many cases, normal flow returns once the blockage is removed. Now let's talk about low testosterone. This is one of the most overlooked causes. If your levels are low, doctors may recommend hormone replacement. This is called testosterone therapy. It can be given as injections, gels, or patches. In my clinic, I have seen men regain energy, desire, and improved function within a few months. But this treatment must be monitored. Regular blood tests are important because balance matters. Too low is a problem. Too high is also a problem. Now you may ask, how long does recovery take? It depends on the cause. If it is medication-related, changes may appear within a few weeks. If it is hormonal, improvement may take 1 to 3 months. If it is after surgery, some cases improve over time, while others may remain the same. So patience is important. Consistency is important. Let's talk about lifestyle. This part is powerful, and many men ignore it. Control your blood sugar. If you have diabetes, keep it stable. High sugar damages nerves, and nerve damage affects ejaculation. Control your blood pressure. Poor blood flow affects the entire system. Exercise regularly, at least 30 minutes a day. This improves circulation and hormone balance. Eat well. Focus on protein, vegetables, healthy fats. Reduce processed food and sugar. Sleep well. Your hormone system depends on good sleep. 7 to 8 hours matters. Reduce alcohol. Too much alcohol affects nerve signals and hormone levels. Now let me ask you, are you taking care of your body daily or only when something goes wrong? Small daily habits make a big difference over time. Let's go into simple do and don't. Do follow your doctor's advice. Do take your medication as prescribed. Do go for regular checkups. Do manage your health conditions. Don't ignore symptoms. Don't self-medicate. Don't stop treatment suddenly. Don't assume it will fix itself. Here are some home tips you can start today. Stay hydrated. Water supports overall body function. Practice pelvic floor exercises. These are simple muscle exercises. They improve control and support ejaculation. Reduce stress. Stress affects your hormones and nerve signals. Try deep breathing. Try short daily walks. Even small changes help. Prevention is always better. Keep your health conditions under control. Go for routine checkups, especially after 40. Review your medications regularly with your doctor. Treat infections early. Do not ignore pelvic pain or discomfort. Now let's talk about common mistakes. Many men ignore the first sign. They wait too long. Some feel ashamed and keep quiet. Some search online and try random solutions. Some stop their medication suddenly. These mistakes delay recovery and sometimes make the condition worse. In my clinic, I often tell patients this: the earlier you act, the better your outcome. Here are important things doctors want you to know. Dry ejaculation is a signal, not a sentence. Your body is asking for attention, not giving up on you. Most causes are manageable. Many are treatable, but only if you act early. Also understand this: your ability to connect, to feel pleasure, and to enjoy intimacy does not depend only on semen. Do not measure your worth by that. Focus on your overall health. Now, when should you see a doctor? If this happens suddenly, if it keeps happening, if you notice pain, if you see blood in urine or semen, if you have fever, if you notice numbness in the genital area, do not wait. Get checked. I repeat this again. Do not wait. Early diagnosis makes treatment easier. Let me give you a simple summary. You can feel orgasm without semen because the systems are different. The main causes are backward flow, blockage, and low testosterone. It can be treated. It can improve. Your job is to identify the cause and take action. Do not ignore it. Do not feel ashamed. Take control of your health. This video is for educational purposes only and does not replace a consultation with a qualified doctor. Thank you for watching. I appreciate your time and your trust. If this helped you, share it with someone who needs it. Like the video so more men can learn from this. Subscribe to the channel for more simple and clear health information. I will see you in the next video.